Everybody, welcome back. Today we're going to be doing a long leg, slightly bent long leg cast, as well as a few other things at the end. And then we will segue into another video afterwards. While the patient is wearing the long leg cast, we'll do some crutch training video as well, using the following supplies. I've got everything laid out here. Quite a lengthy bit of stockinette. A couple of scissors, the ones we use by the patient and the ones we don't use by the patient. A fair amount of padding because I'm about to do a long leg on a teenage size leg. And of course the fiberglass. So we'll go ahead and switch over and get started. So the first thing we're going to do is we're going to apply the stockinette, the first part of the stockinette on the upper part of the leg. I cut the stockinette into two pieces just because it's easier to work with, especially on a teen or adult size leg. So this will be the stockinette for the upper leg. This will be the stockinette for the lower leg, just like you would do on a short leg cast. I like to stop below the knee. You want to try to leave a little bit of an opening in the popliteal space and at the bend of the knee, because they're going to have a slight bend in their knee, and you don't want it to kink up or wrinkle up back here and cause blisters or cause a little skin breakdown. Particularly with the younger kids, is they stay very, very active, and that gets bunched up in there if you leave it as one solid piece, or if you don't cut away the back piece. It gets bunched up and they end up coming in with a little bit of skin breakdown, and that tends to upset the parents when they see that. I'm going to cut away the excess, and then what I was just talking about behind the knee, I'll show you as well. You can do the same thing here on the bend here at the ankle, because depending on what the doctor's orders are, they're either going to want the foot flexed at a right angle or close to it, depending on if it's weight bearing or not. But the one thing they're not going to want is they're not going to want a foot drop. They're not going to want the foot to be dropped down in the plantar position, because that's going to make the Achilles heel in a shortened position, and that's going to cause problems and require therapy after the fact. So what you're going to want to do is, if you're going to do one solid piece of stockinette from below the knee all the way to the tips of the toes, you want to go ahead and cut that little space out there, so the same thing, it doesn't get bunched up or kinked up in there. What we're going to do now is proceed on to the cotton. All right, so we're going to go ahead and put the cotton on now. What I'd like to do is I'd like to do this in two parts so that you can see the two angles we're trying to accomplish, the angle in the ankle and the bend in the knee. So what we're going to do is most of the time this cast is ordered for a mid-shaft tib fib or a proximal tib fib, and sometimes a distal femur. And of course it can be ordered for any variation of knee injuries, Salter-Harris 1, 2, and 3. So what we'll do is I'll isolate where I would assume the fracture would be, or why the cast is being ordered. I'll stop right below the knee, so that I don't want to put an excess amount back in that crease back there in the back again, because again, same discussion I said a moment ago without repeating myself. We'll go ahead and take care of the foot now, get this out of the way. You want to go to about the print side of about the print where the mid print is of the big toe. You want to leave a little bit of the toe sticking out so that the patient, or in this case the parents, can check, capillary refill, skin temperature, stuff like that. Make sure that you didn't put the cast on too tight. The padding and the cast and the fiberglass and the stockinette, none of it have to go on tight at all. You just lay it on snug. You'll notice I'm kind of shearing as I'm going here to kind of give it a good fit. And then whether it's weight bearing or not, I will almost always reinforce the heel. Almost always. I won't put it like a crazy amount, but I'll definitely put enough there for a weight bearing surface. Most of the time when you're doing a short leg or a long leg, the doctor will usually order a cast shoe, a Velcro cast shoe for weight bearing cast. However, I like to I work predominantly with kids, and I know that they're going to tear up the bottom of this cast, so I usually reinforce the heel with at least 3 or 4 strips, which you'll see me doing now. And then, just like we do with the arm cast, and you've seen me do in previous videos, I'll take a strip and I'll reinforce the edge where the cast will end, and in this case where her toes will be, I'll reinforce it with a bumper, And then what I'll do is I'll kind of flare it out a little bit. And that way, if she needs to get in there, the parents need to get in there and clean in between the toes or whatever with some Q-tips or alcohol or whatever. And then if you flare it a little bit, when they're weight bearing, they won't get blisters on the tops of their toes. So we'll stop there for just a sec while I get the fiberglass ready. And we'll go ahead and fiberglass the lower leg. And then we'll accomplish the angle that the doctor's requiring in here at the ankle. Once we accomplish this and it starts to harden just about midway, I'll start working my way up the leg, and we'll start working on accomplishing that bend in the knee. This is the best way to do it when you're working alone. If you're working in tandem with somebody else, you can do the whole thing all at once, and it works out very, very well. One person can maintain this angle while the other person maintains this angle. As you can see, I'm using my body, since I only have two hands, to try to accomplish the very first goal. So we'll start with this, and we'll work our way up, since I'm assuming that I'm working solo. And we'll pause there for just a sec. Okay, we're gonna go ahead and start with the fiberglass now. On purpose, I am going to use different color fiberglasses so to distinguish the different phases of what we're doing. We're gonna go ahead and start fiberglassing the lower leg to try, like I said, to try to maintain that angle, that right angle in the ankle. I'll come around, and again, like you've seen me do in multiple videos, I'm just laying the fiberglass on there. It does not, I don't ever have to pull it tight at all. It lays on there, it does its own thing. And in the next few minutes, it'll start to harden and become a cast. So the lower leg, I'm beginning the lower leg with red, and you'll see why in a few minutes. I'm going to go ahead and place this chuck or underpad between myself and the red dye so it doesn't get on my scrubs, and try to maintain that angle on her, that right angle, using my body, my torso, while I'm using my hands to create the cast. This works really, really well if you're solo, and again, if you have an extra set of hands or a parent that wants to help you, whatever, you don't necessarily have to do it in this manner. You're going to come back and fine tune that in just a moment. You'll notice here that I've made it all the way up. I'm going to leave about a 1/2 inch to 1 inch of space between the end of the padding and the fiberglass, because I don't want it to make contact with the flesh. And we'll stop right about there. So I'm going to cut off that little piece so I'm not having to chase it. If you were wondering about this excess over here, I did that, and you've seen me do this again in other videos as well. You fold this over and you create a nice soft bumper so that her toes won't rub. And then of course, this will make the parent, if you're working with kids, this will make the parents happy so they have access to the feet, to the toes here. Flare it out, make sure you have lots of room for the toes to move up and down. Thank you, ma'am. And you'll notice here the chuck that I was using, just that few seconds that I had the foot pressed up against me. I'll go in close so you can see. The dye comes off very, very easily. So I'm going to place that back between her and I, and I'm going to maintain that nice right angle. I'm going to shape it a little bit right by the Achilles so she has a nice fitted cast, not tight, fitted. And as I'm holding that position, I'm going to ask the patient to slide to the edge of the table towards me so I can start eyeballing what I'm going to do with the upper part of the leg. Come towards me, please. Keep coming until I say stop. Keep coming. Keep coming. While she's sliding, I'm maintaining this, and stop. Now, what you can do if you have a patient you can communicate with, you're trying to maintain this angle and have them flex the knee just about, and we're just going to assume the doctor's orders are 10 to 12 degrees, 10 to 15 degrees. You want to make sure that the center of the knee goes right down the center, the second phalange. So you want to keep a nice center line. You don't want the leg to bow out. You want to, of course, accommodate for whatever fracture or whatever injury is happening. And while this is starting to harden, you can go ahead and start placing the padding on the upper side here. So you're kind of doing two things at once now. You're maintaining this, and you're starting to work with the padding. So we'll work our way all the way up the leg with the padding, and then I will do the upper part of the fiberglass, the upper leg, before this hardens all the way, and I'll connect the two, and I will show you how I do that in just a few moments once I get this padding done. So I'm going to go ahead and do the upper portion of the cast in green so you can see where I connect. You can come a little closer if you want. I'm going to connect the green with the red, and I'm going to overlap it at least halfway, if not even 2/3. I want to make good contact with the red at least 1 or 2 times so that you have adherence. The green will stick to the red as long as the red still has a little bit of the active resin going. If you wait too long, and too long is typically 2 or 3 minutes or longer, the green will not stick to the red, and then you'll have a problem. You'll have a patient return with a failed cast or a cast that's broke down like right in the middle. Again, you can avoid this by having 2 people make the cast instead of 1, or if you can work very, very steadily, you can of course accomplish it on your own. I went ahead and did the extra bumper at the top of the thigh, but for respectful reasons, we did not put that on video, but I can assure you there's an extra bumper at the very top, just like we did at the toes. And we'll go ahead and, just like we do on all the other casts, we'll bring the fiberglass up to about 1/2 inch from the edge of the cotton, so we have a nice thick bumper there. And we'll go ahead and finish off a good portion of this green so that it's nice and solid. And like I said, do not at all feel bad about bringing it back down into the red. And even if you have a little bit more overlap than I mentioned, that's okay. It's more connectivity. So I'm gonna turn around to get my scissors, which I left behind here. Or no, I didn't. Oh, here they are. I'm sorry. And we'll stop there, and we'll fold. You don't have to get this on video if you don't want to. I'm just folding over the stockinette. There we go, and we'll pause there for just a second while I get the next phase ready. So what we're doing now is we're going to go ahead and lay the top coat, the top color that the patient chose for their cast. The cast is already hard, and we're going to go ahead and just wrap all the way around nice and comfortably. Rub out any of the little wrinkles, the little gaps. The cast, the underneath layer is already hardened. I'll go ahead and use this just so I don't get blue on my scrubs, but I don't really have to lean into her anymore. The cast is already set up. And then the same thing as we did with the green, you want to try to get the top layer, in this case the blue, you want to get it affixed rather sooner than later so that it does actually stick a little bit to the green. Can you bend your knee a little? We're having a little wrinkle there. There you go. Thank you very much. I appreciate that. And again, the lower portion of the cast, the short leg portion of the long leg cast has already hardened. We have a little bit of pliability left here in the upper portion, which we can work with while I'm putting the top layer on. But we're pretty much almost done with the long leg. And then just depending on the doctor's orders, you will either A, fit the patient for a cast shoe, a Velcro cast shoe, or if the doctor does not want them weight bearing, we won't. So this will be the end of the long leg video. If you'd like to continue watching in a few moments, we are going to segue this video into crutch training with the long leg cast on. Thank you for watching.